All right. Good morning, good afternoon, and good evening, wherever you're at in this great, big, beautiful world we live in. My name is Cody, and I am the host of the Behind the Premium podcast. And have we got a show for you today? So if you've ever felt open enrollment is your favorite time of the year, then you can just swipe past this video. But if you feel like it's one of the most stressful times for you, have I got a lineup for you to talk about open enrollment and some of the scary, horrific stories that they've experienced and some potential solutions to help you overcome that fear. So let's go around, everybody, and introduce ourselves. We'll start with I guess to my right on the screen up there. Rhonda, do you want to go first and take about 30 seconds to introduce yourself?
Sure. My name is Rhonda Nurnberg. I'm the founder of Welltrio. Been around for about 10 years. Prior to that, I was a nurse. I hate overspending for healthcare, and so I've dedicated my career to find ways to value every single dollar and make sure we maximize it and don't overspend.
Awesome. Well, thanks for being here. Anessa, you're up next.
Hi. Hello from San Francisco. So my name is Anessa Rizik. I am currently with Sunstone HR as a fractional consultant. And I have many years of experience in people and culture in startups, mid-sized, big companies. So across the board in biotech, tech, and retail. So definitely I've been in this open enrollment process many a time as an employee and as an employer, and obviously in the HR aspect, and happy to connect and chat with everybody today.
Awesome. We're excited to have your input and your perspective. And I agree. I've been on both sides of open enrollment, and there are some good stories that I've got to share as well. So next up, we've got John. Go for it.
Yeah. My name is John Knutson. My business is Knutson Benefits Group. I have been doing this for 21 years. I'm an insurance broker trying to help businesses better navigate this whole thing. And I'm on a crusade. This whole insurance market is a mess. And we are realizing that there's a better way out there. And so we're trying to educate employers on the fact that they don't have to rent their health insurance anymore. They can own their own health insurance plan by taking control of it and doing it in a much better way. So excited to provide some insight on that.
I like that take, rent versus own. I like that. I'm pretty sure we'll come back to a couple of things and you'll probably dive a little bit deeper into what that means. But yeah, let's keep it rolling. Joylyn, go for it.
My name is Joylyn Jepson. I'm in beautiful Heber City, Utah. I've worked in the HR space for over 20 years. I've mostly worked with small companies. So I've been a department of one for a long time and have done many open enrollments.
Yes, I agree. All right. So last but not least,
thank you.
Monique.
Thank you. So my name is Monique Maletich, and I'm located in Eastern Oregon, and I work alongside Rhonda with Welltrio, and we've been working together for about 8 years. She brought me in to take over some health coaching, and now I specialize in I'm a benefits advocate. So not only do I get the pleasure of working with people, which is my passion, but I also get the pleasure of helping them save money while taking care of themselves.
Awesome. Excited to have your perspective as well. And if you guys can't tell, today's podcast is sponsored by Welltrio. We appreciate them helping us build out this discussion of us taking on business healthcare so that they can take absolute control and save. So we're here to talk about all the different things that a lot of businesses face. But today we're specifically talking about open enrollment. So my first question to all of my panelists, give me your number one horrific story or situation that makes you fear open enrollment each and every year. Feel free to just jump in. Go for it, Vanessa.
So as I was a head of people in an organization recently, I got the new rates about a couple of weeks before open enrollment was about to start. And guess what? The increase was 24%. And that was a huge shock. And so with the financial times right now and balancing what the employees needed versus what the company can also finance. It was a scramble. So had to come up with a plan, look at all the different aspects. And we did, I mean, we did do the right thing. We took the burden mostly on the organization. But that being said, there was some burden on the employees and specific groups. And we had to kind of I did maybe 5 different scenarios and kept refining so it could balance both aspects of the organization for the people, which is the most important, and obviously for the financials of the organization. So that was an open enrollment shocker. It's a company, they do this every year, but for some reason they decided to give us the updated rates only literally 2 to 3 weeks before. And so it was a scramble. And then, but the other aspect of it is obviously I had to coach and explain that to the organization with the leadership team backing and things along those lines, right? Because you don't want to be big bad HR person that raised your rates, right? So that was definitely a shocking and scary time for us, but it turned out well in the sense of being able to scramble and create the scenarios and figure it out. And but yeah, that was not a fun time.
It doesn't sound like it. I bet a lot of these people here can relate to what you went through there for sure. So thank you for sharing that. Does anybody else have one that they want to share?
Well, this year I've got a 19% increase, and which I'm not happy about. But one of the years I was working with a company that we had a sister company, and we were owned by a larger company, and they were going from a more traditional low deductible health plan to a high deductible health plan with an HSA. And which there's a lot of good things about it, but the HR manager of the sister company was the one leading that open enrollment. And, you have to understand high deductible health plans and how they work. Well, she saw it as a scam, and that's how she presented it to all the employees. And I'm sitting there just dying. And I thought, great, because change is scary enough for employees. And so if you have the person who's telling you about it, telling you what a scam it is and how bad, it was a horrible open enrollment. It was horrible.
I bet that year everybody was looking to their spouse's employment for providing the insurance that year.
Exactly.
No, that one's crazy. All right. Can anybody top that one?
Can I go, Cody?
Go for it.
So I have some teenagers that for the first time over the weekend, they went to a haunted house, and I had to just tell them, it's not real. Okay. So it's really scary. It feels scary, but you got to just realize it's not real. And I've kind of realized that from my seat as an insurance broker, these renewals that these insurance companies come out with, don't worry, it's not real. Most of the time, these are just starter renewals. And so if anybody's getting word from their broker that their premium's going up, and it's going up a lot all over the place, by the way, I'm seeing a lot of super scary renewals, but you've got to know that these insurance companies are playing a game, and the game is highlighted in this story. So it's happened to me many, many times, but this is one of the things that really got me irritated to the point of saying, we got to change this. An insurance company calls me and they say, hey, we've got your renewal for your client. We just want to talk to you about it first. Okay, well, how's it going? Well, we got a few things going on, and we feel like we need to increase price. Okay, well, what's it got to be? And they tell me, for example, it's going to be a 20%. Ouch. Okay, 20%, that's pretty bad. And they said, yeah, so what do you think your client's going to do? And I said, well, they're going to ask me to go out to bid. Oh, are you serious? They're going to make you go out to bid? Well, we don't want a 20% going out to bid. Actually, the renewal should be a lot higher. We're going to give you, officially, we're going to give you a 27% renewal. Okay. Are you serious? Yeah. I'm not going to release a 20 if you're going out to bid. So if I don't go out to bid, you're going to give me a 20. But if I do go out to bid, you're going to give me a 27. So this literally happened for a client of mine. And we went out to bid and just, like most brokers do, we just shopped the market, got a bunch of different insurance plans and lined them up. Went back to the current carrier and said, we've got some really good options on the table. Is this the best you can do? and they said, let me talk to underwriting and I'll get back to you. They came back with a 6. So they went from 20 to 27 down to a 6.
Wow.
And that's what I just thought, if we didn't do our due diligence, you would have just passed along a 27% and the group would have just rolled over and figured that's just the way things are. It makes me cringe to think that maybe groups are actually doing that. You've got to work it, you've got to look at it, and ultimately you've got to get rid of these insurance companies. It's the fox guarding the hen house. I'll just say that. We can get more into that later, Cody, but that's
for sure. I'm excited to. But yeah,
that's why they gave me a 2 to 3 week time frame where I couldn't shop around.
Oh yeah, exactly.
Exactly, John. They knew.
Yeah, it definitely sounds like a 19-year-old car salesman trying to get his first sale. If you come right now, I will get you this. But
yeah,
no,
So-
interesting.
John, I think you and I could get along very well.
yeah.
Open enrollment and the ride that we're being taken on just absolutely gets me out of bed in the morning and makes me want to fight. But that during that open enrollment, when they come back with these crazy bids, I just know there's so much wiggle room, and every time they come back with A, B, or C, and someone like Joylyn or Anessa has to pick A, B, or C, it's like we talked about this last week, Cody. It's like you're in New York and you have a crappy apartment and you have a lease, and they're giving you 3 options in New York City, but there's 30,000 other options out there.
Right.
And they say, and your rate's going to go up. But the reason we don't go and buy an apartment, which you talked about, or find a better rental, which never pays, is because we're afraid to move. So the number one biggest fear I have when it comes to open enrollment is how are the employees going to react. And the best thing about a self-funded plan is the benefit doesn't change, the carrier doesn't change, but you can shop all day long to find a different stop loss provider. But the benefit stays the same. So the employee doesn't have to move, but you can shop. And that's why I love self-funded plans.
Yeah. I'm starting to lean more towards self-funded plans myself. But anyways, I'll tell you my horror story. Monique, if you have one, do you have a good story? I'll let ladies go first.
Well, I don't have specifics, but I feel like every year the constant scariest part I see is employees and not understanding benefits and then being put in a super short time frame where they have to make selections. And then it always, without fail, 6 months later when something comes up and they're so sure that their benefits were going to cover it and they have no idea, they're in a deep, deep hole and they're frustrated. Why didn't I know this? And it's because they aren't given the time and no one has taken the time to sit down with them and truly explore these benefits.
Yeah. And that's actually where my story comes from. I got hired for a company that was out of state. I ended up moving, did the whole relocation thing, and a brand new state, brand new city, walked into the HR department and they gave me option A, B, or C, right? And they gave me 24 hours to make my decision on what I wanted. And I was unfamiliar with the insurance provider. I knew that there were a couple in the state. I didn't know who was the best one. I'm sitting here talking to Mr. Google, trying to figure out what was the best insurance place to go through. And then I had a whole bunch of questions and I walked into the HR department and I asked the HR person and they looked at me like a deer in the headlights. And they said, I have no idea. These were just the options that we were presented with from our broker. And this is what we've got. And I'm like, okay, well, what about this or that? Yeah, I'll give you the phone number of our broker. You could call them directly. And I was just shocked. I was just absolutely shocked. And to Monique's point, just the employees not knowing what benefits are available to them. And it was horrific. And I will say that I chose poorly that year, but I didn't make the same mistake again. I was able to do more research when it came around the second year. But so that kind of leads me to my next question that I want to ask you guys. And maybe Monique, you can take the lead on this one because you do work with quite a few employees one-on-one as a health coach there. What kind of emotional feelings do you feel that a lot of these employees come back? Because I mean, there are some, you guys in HR are awesome people, but I get that it's a very short window. For me, HR and open enrollment is like tax season for accountants. Very short window, very overwhelming. I know you guys are doing your best, especially when it's a team of one, but to try to educate and try to portray this. Let's go on to Monique and let's kind of get some of that flavor that she's seen from the employees, some of the frustrations or emotional kind of things. What are you seeing on your end?
Yeah, I think it's disappointment is most common what I see. Frustration, it can cause financial burdens for them down the road. And even immediately, if they don't understand the quality of what they're paying for and they're paying extreme high premiums for really essentially crappy service and crappy benefits. And so frustration is a big one. Lack of knowledge is another one that I think feeds in to the frustration that employees see. And that's probably like the number one thing that I deal with is just disappointment in benefits that are available or not available, and they just don't know the difference between the two. And then frustration with plans they select and not knowing how to choose the right plan for their particular personal situation.
Right. And now to the HR people, kind of curious because I mean, you have limited time. I think, Joylyn, you said that you service 80, 85 people or something like that. You have limited time, limited bandwidth to kind of sit down one-on-one with these guys and really talk to them. And even if you do, a lot of them are just shaking their head saying, yes. How do you guys combat that to try to make sure that they're choosing the right plan and that they fully understand that? What are some of the tactics that you guys use to help employees?
Well, I was just going to say, Cody, I know that Jolyn and I are not the HR folks that would have given you the 24 hours and would have explained the benefits portions of it. So, I could start. I think communication is a big key for me. I do a lot of webinars ahead of time, depending on, also on site, like lunch and learns, a lot of different communications. And depending on the broker or the partner that I'm working with, I also have them present and even do scenarios. I've had them kind of take scenarios and calculate. And then again, depending on the platform, some of the platforms have those kind of calculations, but really walking through. And then, yes, bandwidth is always a situation and depending on how big the organization is. But there are times where I will personally sit down. I mean, you cannot tell them what to pick, but you could kind of go through, my biggest thing about, high deductibles, let's say, it's an example of, if you have, are you willing to pay less out of pocket first and more later and do like a health spending plan? So kind of trying to educate them without pushing them in one direction or another. And the other aspect is also kind of looking at the population and really kind of giving them the curated plans too. So that's been a tactic that I've used.
So I'm with a small company, so my employees don't get choices. There's one plan. And, which is really, I feel really bad about that because what's best for the company and maybe, individual A and B isn't best for individual C and D, but I have to pick one plan that's going to encompass for everybody. Mm-hmm. I provide a lot of detail in a pretty decent benefits guide. And I actually put it together because I want to, I'm the one that they're coming to asking questions. So I know what questions they're asking. So I'm trying to put it into there. And, but one of the things that I find, and this is true, whether it's benefits, your kids, it doesn't matter. You can tell people things and they don't listen until they need it. And so like my current health insurance that I have has some they're pretty proactive about trying to help employees find better ways to spend their money. And there's a lot of resources there, but my employees don't pay attention to those resources. And then 6 months down the road, I overhear a conversation. And I'm like, well, don't you know they have this that can help you? And so trying to help employees save money in that, if your doctor tells you to go get an MRI, there's a cheaper way to get an MRI, but they think my doctor said, go to the hospital, which is the worst place to get an MRI, because the doctor told me that's where to go. It's the best. Even though I tell them, there's all these ways that you can save money. It goes in one ear and out the next until they need it. And that is super frustrating. And when you're sitting either in an open enrollment period or in an onboarding period, telling them these things, they don't need it yet, so they're not paying attention.
Yep. I would agree. I worked for a company that had a lot of, it was kind of a call center thing. And there were a lot of younger people. And they say, oh, I get benefits? Great. Okay, what's the cheapest option I can get? And then when they have I don't want to say a major accident or anything like that, but when they need it, it's kind of like, oh, shoot, I should have got the better plan, right?
And that's why it's cheapest. Yeah.
Yeah. And I think that a lot of us, when we're that age, single, we think we're young, we're carefree, we can take on the world at any point, right? But sometimes when you take on the world, you got to have the insurance to cover it. That's for sure. So, from a broker standpoint, I'm kind of curious, John, your take as well. As you're trying to not only help businesses, but how do you kind of manage that with that whole thing?
I mean, what Joylyn described really resonates. You do the best you can during open enrollment. And I think it's really about just going to where the people are, giving them multiple resources. If they, we do text campaigns, we do call centers, we do in-person meetings, we do the guides, like anything we can do to get the message out is going to be helpful. But just like Joylyn said, like you can do an amazing open enrollment, but 6 months down the road, they're just not going to remember. And this kind of begs the question. So we've talked a little bit about self-funded plans. Another thing that you could do to take control of your plan is getting rid of the people that answer the phone right now. When they call up and they talk to the insurance company, they're just getting a low-level call center employee that's probably incentivized or told to get that person off the phone as quick as possible so you can get to the next call that's waiting on the other line. So there seems to be a disincentive actually from most traditional insurance companies to try to get answers to employees that are calling in for help. So what we try to do is kick out that typical call center from an insurance company and instead embed a team of people that are living and breathing benefits all day. Healthcare warriors that are going to stand there and take your employees' phone calls right as they call in. And that's powerful because if somebody calls in and says, can I get an ID card? That person on the line is going to understand, okay, they're calling to get an ID card for a reason. And that's when they can start engaging the member and saying, why do you need an ID card? Are you about to enter some kind of a healthcare journey? How can we help navigate and guide that for you? So where we can, we want to embed a care coordination model that helps employees get their questions answered. And it's not people that are incentivized to get off the phone as soon as possible, but people that are rather there to really take care of them and guide them through. So it's tough. It's tricky to get everything communicated and organized and understood. But I think the answer is you just got to do it all.
That's true. All right, Rhonda, I know you've been biting your tongue on jumping in, so go for it.
John, we are the healthcare warrior.
Yes.
Love that.
We need more of them.
We go in. I don't know anybody better than Monique to get people excited about their benefits. When she does open enrollment one-on-one with every employee or her, one of my team, and they walk through the benefits like line by line almost, exactly how to use, when to use, why to use, and gets them excited about what there is there for them. And then we put ourselves there as the in between for all questions. We try to take all of this work off of your plate, Anessa and Joylyn. We give them our number. Every employee has a dedicated health coach and a dedicated nurse. So when they have a question, when they need a card, or they're about to embark on a knee transplant, or their kid has croup in the middle of the night and they don't know what to do, they call their coach. Their coach answers, and then we escalate up to nurse or provider, and we make sure we're directing, or what we call logistics, getting them the right care at the right size care. And we are answering all of their questions, and we don't do any, we always a warm handoff. So we never say, call this person, or check this link, or go to this app. We call with them. We share screens and go onto the website with them, help them find their explanation of benefits, or what was paid, or why it wasn't. And then we call their provider with them. So we are definitely your healthcare warriors.
Yeah, if I could add to that too, I think one of the things that we're talking about is that benefit advocacy. And we have this gap of time that tends to be really short during open enrollment, where everyone's like an advocate for you making the right selection on your benefits, giving you the least amount of information in a tiny amount of time. But in what we're doing, we're with you, advocating for you to utilize your benefits in all the ways possible, while saving you and your company money and making sure you're getting the utmost care. Like Rhonda said, it's meant to be warm care, warm handoffs. We are there to answer your call at 2 a.m. when your child is sick and you don't know what to do next, or it's your first baby and is this a normal sounding cough, right? So we are advocating for you not only during open enrollment and utilizing the benefits and understanding them, but throughout the entire year. And so I think that's really the big difference.
High touch
Yeah.
all year.
Yeah. I think that's a good thing to know. I mean, I refer to my wife quite a bit because she's my healthcare expert when it comes to our insurance policies and plans that we have. And so, she's always telling me, hey, well, we got this, we got that, let's go for it. So I think having that person that you can go to that knows your plan, knows your ins and outs, and it's not Google that's generalizing thing. It's not AI that's kind of like, hey, this is what you should be doing if you have this plan, but I don't have that plan, right? And so having a lot of misinformation is very trying. And I think, you look at some of the catastrophic or even just some of those life-changing kind of situations, that's the last thing I want to do. Like right now, I'm dealing with having to go through with my older parents right now, dealing with all their healthcare stuff. An incident happened about a month ago, and I'm having to take over a lot of things, and it's overwhelming. It's a full-time job. So, I always tip my hat to you guys for sure on that one. But, that does bring up kind of the next question that I want to ask you guys. When it comes to open enrollment, we've talked about some horror stories, but what's one thing, if you guys could change just one thing, what would it be and why?
I mean, I think for me, I know it's not how it works, but I would want to be able to make, if I had a magic wand, I would want to be able to make changes throughout the year, or at least throughout maybe the first month or two. I mean, throughout the year would be great, right? Because you never know where your health situations will take you. And so, and especially for employees just coming into the workforce, I mean, they're bound to make mistakes, right? And actually even people long into their career. So that would be for me to be able to kind of make changes throughout the year. It would be great, but maybe even throughout the first 90 days would be awesome. Not for a life-changing event, but really just kind of, I've tried this plan, not the right plan. Let me try, you're not going to bargain shop, but maybe at least make 1 or 2 changes throughout the year.
Right.
Yeah. As long as you can stay within the box that they give you, make a few changes. No, that's a good one. Anybody else?
I wish that I did have multiple plans to offer employees, because depending on what's going on in your life, different things fit you better, right? And everybody has a different comfort level. But another thing that I wish is that even as an employer, that as I get these bids that come in, they give you a very simple plan summary. You don't get all the ins and outs, and it's very hard to understand the ins and outs. And so I wish it was easier as an employer to understand the ins and outs of the different plans, and to make sure that my employees understand the ins and the outs. You get something that says this is your deductible, preventative is covered at 100%. You pay 20% after your deductible, but it's in the fine print that this isn't covered and that's not covered. And, oh, well, that doesn't qualify as preventative or whatever. And it's all those little tweaks that then catch somebody up when they need coverage. And as an employer, you don't always know what that little, like, I signed up for a health insurance plan, and it was supposed to go in effect January 1. And we had given, all of our census information. Well, we had one employee in Hawaii, and I found out on December 21st that our new insurance coverage would not cover him.
Oh, man.
And they were expecting a baby. I'm like, you can't tell me this, 2 days, 3 days before Christmas, when our plan is supposed to go into effect in a week. And, that's one of these like little details that makes a huge difference. And I didn't have that information. Anyway, and so I wish it was easier to really understand the ins and outs of whatever you're purchasing, whether from an employer aspect or an employee aspect.
That makes sense. John, you're shaking your head. I'm curious what your thoughts are.
Man, what would I change? I'm ready to throw the whole thing out. I'm telling you, this is such a problem. This is such a mess. And we're on the verge of something great. We are. Perhaps it's not news to any of you here on the call, or maybe even those that are listening. Did you know you can go to providers and doctors and hospitals and offer them a payment in cash and get a deep, deep discount, far, far less than what any insurance plan could ever provide? We typically, when you're dealing in cash, you have to set aside your insurance. We are now experimenting and putting together plans that will embed cash as the front-facing element of the plan. The employer is paying premium. The employees are contributing. We're holding money in reserve. This money that we're holding in reserve now goes out and works as cash. Cash negotiations up front. I'm talking no networks. You go to any doctor, any hospital. Hey, everybody takes cash. No networks. Open enrollments, deductibles, co-insurance, out-of-pocket maximums. You don't have to worry about it, because when we negotiate in cash, we get such deep discounts. We're setting up our plans so the employee pays nothing for healthcare. So I see a bright future, and it has, and it's getting insurance companies out entirely. Maybe behind the scenes, some kind of stop loss policy that covers anything super catastrophic. Otherwise, let's get everybody with a nice debit card out there instead, and let's let cash be king and make these deals happen. So I'm ready to toss the whole thing out, man. I'm sick of this stuff. This is coming from an insurance broker. I got problems.
You're ready to push the button. All right. I like it. Monique or Rhonda?
Yeah, I'll kind of piggyback on some of the HR comments that were made about the ability to help people make these decisions and have all of the information and not knowing things until the last minute as HR. The wonderful part is, like, working with WellTrio, for example, we have that information. We're digging all that information up before we even get to open enrollment. We know all of your people super personally, super intimately. We know, are there someone that is hoping to get pregnant? People aren't going to want to come to HR and talk to them about their hepatitis diagnosis that they need treatment for. They don't want to talk about STDs with their hiring facility, right? And so the difference is they will come to us in confidence and in privacy and have those conversations, so that when it comes to open enrollment time, we sit down with each of them individually and can make the best plan choices for them because we know them, we know their families, we know their lifestyles. And HR doesn't have that benefit in a lot of situations because you just don't have the time. Like we were saying, the bandwidth isn't there. But that is what people like me and Rhonda are there to do, is we are there to help expand your bandwidth and have that personal touch to make sure your employees are incredibly excited about the benefits that they're getting, because they are exciting. And so that's my job, is to sit down with you, get you really excited about what I can get you that I know you truly need and are spending the money on the right places.
You know, as an employer, you know, one of our biggest expenses is first payroll, right? But then after that, it's benefits. And we spend a lot of money on benefits. And if we're not getting a good ROI on it, it's frustrating. And it's you're just throwing good money after bad, right? And so, you know, within a traditional insurance system, there's a few things you can do to try to design plans that can bring more value, but you're really limited. And it's so frustrating when I hear it's frustrating, not because I take it personally, but when I hear people complaining about their benefits, right? Because I know right now I'm doing the best I can, but it's not meeting their needs. And I understand, you know, it's a whole other episode about how we got here, right? Like, I personally think we messed it all up when we hooked insurance with employment, but that's a whole other conversation. The fact of the matter is, healthcare is now hooked to employment. So that's what we're trying to work with. But when we spend so much money on it, and your employee's like, this is garbage, and maybe it is garbage, but there is a way to make it better, right? It's really disheartening, but it's like something I have to do, right?
Yeah.
You nailed it, Julian. Healthcare was never meant to be run by your company, and yet it's been paired with it. And it is usually the second most expensive thing that you cover. And there's nobody specifically trained to watch it. HR has inherited it, and they're doing a decent job at it. But you would never put HR over accounting or HR over your lawsuits. You would have HR over human resources, and you would have somebody medical over healthcare. And that's what WellTrio brings. But I just want to, first of all, John, we really need to connect after this, because I am all over the cash, leveraging cash and figuring that out, and giving people the Visa card that works like an HSA.
Yeah.
We really got to connect our
We'll have to talk.
We'll have to talk. I lost my train of thought, and we need to talk about it.
No. I'm kind of excited to hear kind of the cash situation and the different things that are coming up. I mean, that's pretty, because I think you're right. Being in my profession, it's I'm always thinking, like, what are the other ways of doing things? Like, how can we make it better? How can we help our employees? And that, I'm seeing out that there's more things to think about, right? Especially now that the insurance rates are going up everywhere. Not just for health, but for everything, house, car. I mean, it's a little bit insane out there. Kind of excited. Like, maybe Cody do something about, like, the new stuff that's coming out there. That'd be kind of cool. But
yeah, we should do one called Cash is King. The healthcare warrior road to success, right?
There you go.
I totally agree with what you guys are saying. I mean, as a small business owner myself, I have owned quite a few different businesses. And the one thing that I dread is the end of the year black box when it comes to the healthcare. And for me, I always wait to hire new employees until I know what my premiums are going to be the next year, because I got to plan for it, right? And so then from there, it's kind of like, all right, well, I'll get creative this next year. So by the time open enrollment comes around next year, I'll be ready for it. We never are, right? We're never ready for open enrollment. But that's why I'm always sweating every time I see my broker's email come to me and say, hey, renewal time. And I'm just like, oh, geez. And I'll be truthful. My company, our insurance is going up 75%. 75%. And I mean, it's unreal.
Yeah,
I do. I need to talk to John. But I'm just saying, like, for me, as a business owner and, talking with Rhonda and talking with a lot of experts like yourself, I am, as a business owner, finally starting to realize that I don't have to settle for options A, B, or C. There are other alternatives out there for me. And the one I'm with John and Rhonda, I think cash is definitely going to be king in this scenario, because if I have to go up 75%, and I mean, I look at most of the people that are on our plan, we're practically healthy. Like, unless I'm asking them specifically, hey, are you going to the doctor? How many times do you go to the doctor? I don't see that data until after the fact, right? And I think that if I could change one thing, I think it would be with Anessa and just being able to make changes throughout the year based upon hiring more employees, which would kick me into a different opportunity for an insurance plan, or even just making adjustments with benefits. Like, the number one thing I hate is waste, right? And so I know I pay for a lot of things. My neighbor down the street, we were just having a conversation just this past week about him and what he's doing for his insurance. And he's like, I'm wasting like tens of thousands of dollars a month because I'm paying for things and we're all healthy and nobody's going to the doctor, right? And so it's like, what do you do in that situation as a small business owner, right?
Well, Cody, you think you're all healthy, but this is one of the problems when you're with a small company. So I've been doing baby steps. Okay. So I was with at a different company I was at. We had a little over 200 employees, and we were just dancing around that 100 employee figure on our traditional plan. And because in order to get the data for our plan, because we were a small company, we had to have 100 employees on the insurance for 6 months before I could get data. And when we finally got it, as soon as we hit that, I'm like watching it. As soon as we hit the 6 months, I'm like getting that data. And like the next week we fell below, but we got it. And what I found out during that time, because our rates were going up and up and up. What I found out is over the course of the year, our insurance company paid out $1.5 million on our company. 1 million of it was for one individual's prescriptions.
Yep.
Wow.
So one person, right, was doing, so even though everybody else is relatively healthy, one person was, 2/3 of the cost of our insurance. And so then I went to a level funded plan, which does not give you as much information as a self-funded, but now I am getting more information. So I have an idea, like back in June, okay, this is not going to be a good year. So I'm not at least blindsided. It still doesn't make it any better, but that's one of the problems too, is, for traditionally you've been waiting there. It's like, is this going to be a 2% renewal or a 200% renewal? Because we're not given any of that information ahead of time in a traditional plan.
Joylyn, you want to know the dirty little secret? Your insurance company didn't spend $1 million on that pharmacy fill. They probably spent $50,000, $100,000, $200,000. They have reinsurance. They have a stop loss protection that paid the rest of it. So they still had the ability to come to you and say, whoa, man, look how sick you are. We're going to have to really up those rates, when actually they only paid a fraction of that out of their reserves. It's a game. I'm telling you, it's a game.
What's even worse, you can get that drug for 1/10 of the price if you are creative and look somewhere else.
Yeah.
That's where Welltrio super exceeds. Like, give me a prescription, I will find it for less. Anytime.
Yeah. It's interesting what John just said there. It's a game, right?
Okay.
And I think I became fully aware of the game when I had a family member that had a massive incident, right? Hospital, a surgery costing well over a couple $100,000 worth of stuff. And they heard about writing a financial hardship letter because they're like, there's no way, I mean, this would bankrupt me, or this would just, I would be paying on this till I'm 80, right? Mm-hmm. And so they wrote a hardship letter and they ended up covering it all. They paid zero out of pocket. And right there, that told me exactly how much margin they build into all this kind of stuff, that it definitely is a game, right? Mm-hmm. And you think about the people that don't take advantage of negotiating and I mean, it's hard to pre-negotiate on getting into a car wreck or coming up with a situation that needs emergency attention. But I mean, there are a lot of things that you can pre-negotiate with as well. And I think, Rhonda, you were telling me about some pretty cool ones that you've done in the past as well. Is that correct?
Yeah, there's a lot. You have a lot more control with a self-funded plan. You own the plan. You actually built the plan. I have made mid-year changes many times. You have to give the employees 90 days notice, but there might be like, I have done things with like that $1 million drug, Joylyn, where it's a specific class and it's not required to cover that class under ACA. And so I can go in and it takes 90 days, but get it all figured out and I can deny it so that our insurance won't pay it. I let the employee know, and then I go buy the drug for cash. So then you're getting it, for 10,000 instead of 1 million, and they're getting the drug they need. But those creative solutions, with the self-funded plan, WellTrio is able to be the in between the purchase and the payer. So when something comes through, we're actually part of the prior authorization process, so we can intercept those drugs before they're filled. If otherwise they're filled and it's been a couple months before you get the data, and now it's been filled 3 or 4 times. So I am part of that prior authorization process. I get an email, hey, this is the drug, and I can say yes. I can say yes for a month, and I'll get it somewhere else after that, or I can say no, and then I call, or Monique calls, and we arrange for them to get the drug. Never sacrificing the drug or the care of the patient, but also not sacrificing the dollars that are being thrown at the game.
Yeah.
There's a lot of control with the self-funded plan.
That's what it sounds like. Yeah. So this message, this kind of next question, I guess, is geared more towards, John, but Insa and Joylyn, feel free to jump in from an HR perspective as well. When you guys are presenting benefit and insurance plans to the employer, have you ever come across a situation when it's a bad plan, but yet the employer definitely chooses it?
Yeah, we've had instances where I'm more talking about like more traditional models. If you're bouncing around from different insurance companies, there are some insurance companies that will give you a low bid quote just to win your business, and they're just hoping that it'll work out. But then the inevitable happens where you spend a lot of money, the group is sick, and the plan blows up, and you have a high renewal from that insurance company. So I've seen plenty of that in my career, and it's what I usually try to do. I really try to help because I never want them to say, "You told me to do this, and look what happened." So whenever I'm talking to somebody about this, and then I get a really smoking hot rate, I like to just tell them, like, this is good for 1 year. This is no guarantee that it will last much longer than that. And I've had some employers just say, okay, thanks for your openness and transparency. I'm not going to go with the lowest bid. I'm going to choose one of these other options because I don't want to deal with that turbulence. But there are times where my client will say, understood. I'm okay with that. I need that savings right now. And we've even had instances where that has worked out, where the sick employees ended up leaving midway through the year. And so that renewal wasn't so bad. And we worked through that. But yeah, you've got to this stuff matters. This is expensive, right, Joylyn? This is one of the most expensive things a business pays for. You have got to be careful. You don't just go changing off of nothing. You got really do your homework. And I feel like it's the job of every broker to be open and honest and transparent to say, this is the truth. This is really what's happening. Don't you dare let your own compensation get in the way of what's right for the employer. I don't care what trip you're going to qualify for by putting them with that carrier. You have got to see it as they see it. This is real money. This is big money, and this is people's health. So don't mess around with that.
You know, and we were on our plan, and I don't remember what the renewal is going to be, probably 10, 11%. And someone came in with a low bid, an alternate insurance company. It was the one who couldn't insure my employee in Hawaii. Mm-hmm. But the CFO and I were both telling the CEO, I think we need to just stay with the plan that we're on. This other one, they're trying to buy our business. We don't know what's going to happen. Anyway, so we went, but my CEO, to Cody's point, was like, right now we just need the savings. We moved over to it. We had the problem with our employee in Hawaii. My CEO ran into a problem with his daughter, and they fixed it because he's the CEO. But he's like, it shouldn't have to be fixed just because I'm the CEO. We shouldn't have this. We had a much higher rate of employees' claims being denied. And later on, I listened to a story in New York Times, and they were talking about this insurance company particularly, that their process was to just deny claims and then let people appeal it. And usually on appeal, it was allowed to go through. But how many people actually appeal, right? And so it was such a bad experience. We went back to the old insurance company. But employees are nowadays usually looking for, three things, but two of which, one is pay, and then the other is their benefits, right? And the employee's experience within their benefit experience really colors their whole relationship and loyalty to their company. And so if they feel like their benefits are taking care of them, they'll put up with lower pay. They'll put up with a lot of stuff. If it's part of this larger, my company is taking care of me. And one of the ways we can take care of our employees is through the benefits.
That's interesting. Anessa.
I mean, absolutely. I think Jalen is right. If the biggest thing is, as employers are getting more educated, they are looking at their benefits, and not just the medical and dental. There's wellness programs. There's a lot of things that go into that, right? And you can build it into an organization. But it's the concept of be careful of what you're buying, or I forget the phrase, but if it's too good to. If it's cheap and it's too good to be true, right? And so, of course, you're going to have CFOs and CEOs looking at the bottom line and looking at things. But hopefully you're working for an organization that is open to a conversation and presentation, and kind of, and you'd work with a broker or whoever you'd be working with to kind of create those scenarios. Yeah, absolutely. Bottom line is always important, especially if things are going financially one way or another in an organization. When things are booming, hey, we have everything. We have massages at work. We have, different, yoga and things like that. But when things are going down, everything's being looked at. So I do understand from a financial perspective, but I always advocate for the employees, right? Because I'm that employee too. So it'll hit, on a selfish reason, but also obviously not on a selfish reason, because as HR people, we really care about our employees and kind of the best. So yeah, of course, I've seen it. Have been able, so far so good. I've been able to kind of work in those parameters and at least get the middle ground. Maybe not the best outcome, but at least the middle ground. So that's been great.
Yeah, interesting. Thank you for sharing that. Monique, Rhonda, anything you guys want to add?
Yeah, I was going to add to something Joylyn said about, feeling disappointed when you're presenting benefits package. That's a really terrible feeling to have as an employer in HR. And like I said, I love sharing benefits because I know what we add to benefit packages that companies are bringing in is incredibly exciting. And I have yet to ever have somebody in 8+ years tell me they weren't excited about their benefits when I'm done getting them enrolled and set up. And for me, I feel like quality employers want to offer quality benefits because they want quality employees. And the better you treat your employees long term, the longevity of those employees, you have less turnover, you have better work ethic. And so I feel like if you're just offering, A, B, and C, this is what's available, this is all you get, and we're going to hardly explain it to you, and you don't know all the extras, where are you finding quality employees that really want that and are going to stick around, especially as they grow and are having families of their own, potentially if they're young coming into the workforce? It's just would be really disappointing as an employer, having to reflect that to an employee and not have great things to offer them. So that's kind of how I wanted to add. I empathize with companies that are in that position. It must be very, very difficult.
Hey, but they definitely have all the free soda you can drink. They have Donut Fridays and Pizza Mondays. It's going to drive me into a pre-diabetic mode, but their insurance sucks. But let's just be real there, right?
Well, what's funny is then the employees or the employers have these soda machines, and then they're wondering why their healthcare costs are going up every single year. And I'm like, well, what did you guys do in the cafeteria all year long? Like, no wonder you're having a really terrible reflection in your healthcare costs next year.
Yeah, that might be a little words of wisdom there for business owners. That's for sure. Rhonda, anything you want to add on that?
Oh, I echo what many of you have said. I think, Joylyn, you're spot on as far as when the employee feels valued, and benefits are such a big part of that. They feel like the company values them. So having a good benefit and tacking on those really good side services that are supporting them and listening to them and seeing them right where they are is really valuable to creating a package that helps your employee want to stay.
Yeah, for sure. For sure. Thank you. We're coming up on the top of the hour, and I want to be respectful of your guys' time. I want to thank you, each and every one of you personally, for coming and participating in today's discussion. Hopefully you guys had some fun. Like I said, it's one of those type of things that we like to let our hair down and just have a general conversation from a lot of different perspectives. So I appreciate you guys engaging with us on that one. And like I said, I do have one final question for you. And, as an HR health benefits type of representative, what is one thing or what is one question that you would tell any employee to ask their employer or HR department before signing up for an insurance plan?
Did Welltrio help select this insurance plan and build it for you? That's the first question I would want them to be asking, for sure, without a doubt.
That's a great question.
I just love it when employees ask questions, right? And they're not just like, but when they start asking questions, then it allows me to better gauge their level of understanding and, and where to go more in depth in. But a lot of times they just sit there and they stare at you, shooting you death rays because they want to get back to work or something instead of, so I just love when they ask a question.
Good.
I think I would want an employee to ask, why did you choose this benefit over any other? What about this benefit do you think is going to be the best for me and my family?
That's a great one.
Yeah.
I mean, I would say, going back to asking questions, Joylyn is right. But also maybe if there's a number of curated plans, like maybe give me one or 2 points from each plan that I can take away with me that I will fully understand, right? So I think it's just breaking it down to the basic level of an employee trying to understand and that they could retain. So can you give me 1 or 2 points for, hopefully you don't have 20 plans because that would be an issue. But if you have 1 or 2 or 3 plans, at least giving a couple of things that the employee could take back, and that's what they should be asking, I think would be great. But yeah, absolutely. Asking questions is the most important part.
Yeah, because I think a lot of employees, they look at the deductible, they look at the copay amount and how much they have to pay. Like that's the trifecta that they really look at, right? Correct me if I'm wrong there, but to me, that would be my question. Make sure you know what those are, right?
And spending more doesn't necessarily mean you're getting more.
Right.
There are calculators that you can plug into really easy online to see if it actually is worth more to spend more.
Agreed.
Cody, a question I would encourage every employee to ask their employer is, did you do all you could to get me the best plan possible? There's a lawsuit going on right now. Johnson & Johnson has an employee of theirs suing them because they are realizing that their cost of care is so extremely expensive because of their health plan that they're unnecessarily paying for that. We're not sure where that's going to go. But if this thing goes through, if the courts side with this employee, what it means is that every employer has got to take this a lot more serious. They need to realize that they hold like a fiduciary responsibility over this money. It is them that stands in the way of their employees getting the best deal possible for their healthcare dollar. And if they are not doing their job, if they are just content with going golfing with your buddy and taking whatever plan he suggests and keep hitting the easy button, no, you need to dig in. You need to look at this stuff. It's changing quickly. There are options out there you need to consider. No matter your group size, you've got to dig in and look at it. And your employees would be pretty upset if they knew and understood that you were hitting the easy button. This is way too expensive to take so lightly.
That's a good one. That's a really good one. All right. Well, I think that we'll just kind of end the conversation there. Again, thank you to our panelists for joining us, and thanks for everybody that tuned in live and is listening to this recorded as well. But let's start with, we'll start on the opposite end this time. We'll start with Monique. If you want to just do a quick 30-second outro.
Yeah. Well, I feel like I just got my plug on that last question, so that was wonderful for me. I think my biggest thing is I read a study recently that was done by Equitable. They do a lot of HR research, and they found that last year, 53% of people who enrolled in benefits were unhappy with the benefit selection they made. And most of those reasons were because they didn't know what their options were, even though HR presented it. And so, if you're a company and a large or small employer and you're not working with benefits advocates who know your personnel really intimately, you need to find someone who will do that, preferably us, because we are amazing and we love our people. But it really is a huge benefit for not only your financial savings, but your employees' financial savings, longevity in your company, and your health overall.
Love it. Love the passion, Monique. That's for sure. That's awesome. Joy Lynn, go for it.
It's a tricky name, I know. So, well, let's see. I don't know what to say. If somebody wants to connect with me on LinkedIn, my name is Joylyn Jepson, is up there on the screen. But I'm passionate about HR, all aspects of it. And if you're in Utah, connect with me on the SHRM level. I do a lot with that, and that's a great way to kind of share experiences and network with other groups.
Awesome. Well, thank you. John, you're up.
Yeah, what I'd say, I think you're hearing it in my voice. I just am, I'm out there trying to make a difference. I sometimes hear, oh, you insurance brokers, yeah, you're all the same, aren't you? I mean, don't you all just kind of go to the same carriers and offer the same plans? We don't. We're doing things differently. We would love to engage with any of your audience and help them see the differences. Cody, man, we need to talk if you're getting a 75% renewal increase, because there's options out there that we'd love to present and show you on. Sure. No matter the group size. I'm located in Utah, but work all throughout the country. So would love to engage with anybody that's interested in talking. I've got a good thing going on YouTube. If you wanted to look for us, Knutson Benefits Group. And also, you go to my website, knutsenbenefits.com. So look forward to continued conversations.
Likewise. Anessa, you're up.
Great. Well, Cody and the panel, thank you so much. Feel free to connect with me too. John, I might actually connect with you on something personally. But I am part of Sunstone HR, and we do fractional consulting. And I'm located in the Bay Area, but we are all over the country. So feel free to reach out to me on LinkedIn. Anessa at Sunstone HR. You can also look at sunstonehr.co. But I'm very I love HR. I've been doing it for a while, and so happy to connect with anyone. And I appreciate the time and for the panel and everyone listening to us. So hopefully we've made some difference in the open enrollment game for you guys.
I think we did. I think we're all in consensus that we're ready to just blow the whole thing up and start fresh, right?
Yeah.
Pay cash. All right, Rhonda, bring us home.
Well, thank you each for joining this panel today. If you're interested in learning more about WellTrio, it's welltrio.com. You can find us on YouTube, LinkedIn, Rhonda Nurnberg at WellTrio also. And if you are any company out there overpaying a prescription, well, let me help you. Just for fun, I'll help you. Give us a call.
Yes, exactly. Rhonda has some good stories, and she is a plethora of knowledge when it comes to this kind of stuff of how to save. So I've learned so much. So thank you again to all of our panelists. Open invitation. Anytime you guys want to jump on any of our panels, you guys are more than welcome. Just, you know how to get a hold of me. Let me know. We got some interesting deep rabbit hole kind of discussions coming up on various topics throughout the week. And so be sure to keep tuning in. And until next time, keep staying healthy, everybody. We'll talk to you later.